Hello and welcome. I am Tabitha Kibuka, consultant to the Health Campaign Effectiveness Coalition, and here to present on the insights from implementation research on the promising practices related to campaign integration. This presentation follows the introduction in part one, in which we heard about the Health Campaign Effectiveness Coalition's research and learning agenda and synthesis methods. I will share information on the IR project and dive into the synthesis results. The 8 IR studies on integrated campaigns had different focus areas and fell into 3 categories: preparation and planning, co-delivery evaluation, and multi-country campaign insights. So HCE supported 3 studies that evaluated co-delivery campaigns on coverage and other outcomes, and conducted process research. Countries included Bangladesh, Colombia, Ethiopia, Guinea, Nigeria, and Rwanda. Other studies covered multiple countries. Most focused on NTDs, while there were some studies that focused on immunization and malaria, as well as vitamin A supplementation. You can click on the links for each of the detailed individual IR briefs. The approaches to each study and each study context, study populations, stakeholders were different, and therefore data could not be pulled, nor could comparisons be made across studies. Now I'm going to walk through findings. The campaign integration synthesis results were organized as follows: outcomes, themes, which include enablers and challenges and solutions, and promising practices. This slide provides a high-level overview of the outcomes identified across the IR studies and a summary of the evidence related to these specific outcomes. 6 outcomes identified across the IR studies were measured in some of these studies. These include coverage of co-delivered interventions, beneficiary safety, community acceptability of the integrated campaign, opportunity to identify and refer zero-dose individuals, cost-effectiveness of co-delivery, and improvements in knowledge, attitudes, and practices. I will highlight information on 3 of these outcomes. The first outcome we'll look at is coverage of co-delivered interventions. Coverage remained high in a scenario of co-delivery co-implementation in projects in Nigeria, Ethiopia, and Guinea. In the study in Ethiopia, the post-campaign survey findings conducted by Jimma University and partners on co-delivery of 2 MDAs revealed an overall coverage of 83.2%, a sample size of 2,610 eligible individuals for ivermectin and albendazole for the 2 MDAs. The second outcome I'm going to talk about is around beneficiary safety. In the study in Nigeria, which integrated vitamin A supplementation during the seasonal malaria chemoprevention, or SMC campaign, adverse drug events at endline were reported in 1.6% of children receiving vitamin A supplementation and 4.1% among children receiving SMC. In Ethiopia, the post-campaign survey found only 3 reported cases of mild adverse drug events, which include nausea, vomiting, and abdominal pain during the integrated campaign of the 2 MDAs. Qualitative data suggests that beneficiaries and health workers said or reported that co-administration was safe. Similarly, in the scoping literature review across the 6 integrated NTD studies, reported that adverse events were mild or transient. Cost effectiveness is the next outcome we wanted to highlight. Cost effectiveness and efficiency were also assessed in a few of the studies. In Nigeria, the project team measured the economic and financial program costs associated with adding vitamin A supplementation to the SMC campaign. Integrating vitamin A supplementation into the SMC campaign introduced an additional cost of 24 cents per child, from 94 cents per child to $1.18 per child. The scoping literature review found evidence from 16 studies that integrated NTD campaigns were more cost-effective than single intervention campaigns. This was measured in a variety of ways, including programmatic costs, cost per individual reach, cost per DALI, and cost savings. Here are the 4 themes that emerged from the synthesis. In the subsequent slides, we'll see the enablers, challenges, and promising practices that fall under each theme. The first theme is collaborative approach to planning contributes to integrated campaigns. For the enabler highlighted here, the project in Nigeria, the qualitative findings from the project in Nigeria indicate that early collaborative microplanning and targeted community stakeholder engagement contributed to the achievement of high vitamin A supplementation and SMC coverage. The project in Guinea, where the study team co-delivered vaccinations for measles and meningitis A, the study team reported that community meetings involving local authorities and leaders were useful for information sharing on the integrated campaign, participation in microplanning, and monitoring of combined immunization strategies, as well as demand generation. The second theme is engaging communities and stakeholders during all phases contributes to acceptance of and support for the integrated campaign. For this theme, one of the challenges is the need to address conflicting priorities and interests from early on in the campaign planning phase. In Ethiopia, where the study team co-delivered 2 MDAs in Jimma Zone, frontline workers had different perspectives about their roles that they would play during the integrated campaign. The health extension workers were interested in having more authority over some aspects of the MDA, while the community volunteers wanted to maintain their roles as drug distributors. The study team took steps to discuss and clarify the roles, and they used a participatory process to foster understanding of the integration approach and improve collaboration. The third theme is government leadership and coordination during all phases ensures a well-planned and coordinated integrated campaign. For theme 3, one of the promising practices is working through a coordinating body to ensure transparency and facilitate advocacy related to the integrated campaign. The retrospective study in Bangladesh, which included qualitative interviews with immunization campaign stakeholders, revealed that central and field level committees were formed for the integrated campaigns. The policy level stakeholders at the highest level set the target population and worked on other plans for campaign implementation, while the field level committees worked on logistics. The fourth theme is the use of digital tools or applications facilitates campaign integration and creates efficiencies. For this theme, one of the promising practices is identifying opportunities where digital tools may be used during all phases of the campaign and plan for their use. In Rwanda, the study team developed a predictive analytics tool that was pilot tested during the planning phase of a maternal child health day, which was integrated with deworming, family planning, and other health activities. The use of the predictive analytics tool in comparison to the use of the traditional manual planning system was estimated by the project to have saved senior staff 10 working days on the integrated campaign planning and created efficiencies. Just to recap, this is a list of the promising practices by the different thematic areas. You'll see here that we've listed the promising practices that support collaborative approach to planning, the promising practices that support community and stakeholder engagement during all phases of the campaign, and then promising practices that support government leadership and coordination, as well as promising practices that support the use of digital tools during integrated campaigns. Now I'd like to highlight the knowledge gaps that emerged from the synthesis. These were the knowledge gaps that emerged from the IR studies. To take it a step further, we came up with potential approaches for policymakers, program managers, and researchers to address knowledge gaps. We want to highlight that addressing the knowledge gaps can be approached in a variety of ways, and there's no right or wrong way to address the knowledge gaps. We share information here on how researchers may generate more evidence on community worker compensations or incentives, and how policymakers could support expanding and evaluating integrated health campaigns. Here, we share information on how policymakers could create a more enabling environment for digitization during integrated campaigns, and how program managers could elicit continuous feedback from communities before, during, and after the integrated health campaigns. And finally, we'd like to thank all of the awardees' research teams who are listed here for their great work and collaboration. We'd like to thank the ministries of health and government agencies in the countries where the studies were conducted. We'd also like to thank the Campaign Integration Task Team, the Working Group, as well as HCE's Scientific and Technical Advisory Group, and other teams of the Task Force for Global Health. And finally, we'd like to thank the funder, the Bill and Melinda Gates Foundation. To find out more and to review the individual IR briefs and synthesis reports, please visit the HCE Coalition website at campaigneffectiveness.org. Thank you so much and have a great day.